I'll still be here.
Megan, I see the live on YouTube, but not the recording. I'll wait till we have both. There we go. Hi, and welcome to what may end up being our final regional report out call. With numbers improving, we feel like we're in a place where we can put this program on hiatus. If it's needed to be picked up, we'll be able to do that as well. So I want to encourage you, if you haven't already, go ahead and go to covid.ks.gov/report-out, and you can sign up with your email address. And if we have something to communicate, whether it's around vaccine or the virus starts picking back up, we can pick these calls up. I just want to thank everybody on the front end who's volunteered to be on these calls week in and week out. I don't believe anybody's been paid extra to be on them, just a service to their region and their neighbors and their fellow healthcare and public health workers. So thank you to all of you, and to Megan and Ryan who've kept it going on behind the scenes. Very grateful. But let me start by showing the dashboard. It's going to look a little different this week. And Megan, if you can make me the host, I'll put it up and we can review the numbers. Thank you. Let's see here. Okay, so what you'll see is north central Kansas is this top blue line. Okay, this is February 15th. And I thought what would be helpful maybe is if I compared it to January 18th, a month ago. And so when you look at this, when you look at the number of hospitalized COVID patients, we were 54 a month ago, now 21. Number of COVID ICU patients, we were at 6 a month ago, down to 2. When you look at available ICU beds, we're right about where we were. We actually had a few extra available, but still with 46%, and we were at 47% there a month ago. So good signs for the region from the hospital capacity side, and we're seeing that all across the state. When you look here, look at the north central region and the number of weekly cases. You can see the good news is the cases are continuing to come down since we were hitting these peak numbers here in November. I also want to come over to the KDHE site. I think it also tells the story. As you can see, red is a plus 15% positivity rate. North of 10% is orange, and then we're into 5 to 10%. And you can see, coming down from the beginning of January, we were at a 12.8%, just coming down every week until this past week, down to 3.9%, back into the blue for north central Kansas. And seeing that along with, let me pull up the case count, which I think also is another way of telling that same story, assuming the website works with us here. Well, that along with what you saw here tells a really compelling story. If you can see both positivity rate and case count going down, it's really helpful. And so I'm going to come here to the vaccine site, kansasvaccine.gov, a great source of data. More encouraging news. We're at least now at 10% of the state population vaccinated, over 100,000 people fully vaccinated with the second dose. And we know these numbers are lagging. We're still having technical issues around data reporting that I know they're working on, but you can, again, as you go down the site, see age breakdown and, daily shots going out, and then what's going on per county in the delivery method there. So also Find My Vaccine has been rolled out. It continues to populate that here again at the top menu. And when you come down, you'll see this state, the state here populate with the different providers of who has vaccine, when they got it. And you can zero in on your community, and they continue to make this more useful. And it has the contact information for whoever you zero in on here, see what they're up to. So you can see Dickinson County Health Department and the number. So a great site to help people as they learn about the vaccine. So we'll come back. We don't have our normal participation from public health this week just because I think they're in the middle of vaccinations. So we'll kick it over to Heather with the hospitals, and we'll tell us what's going on there. Heather?
You bet. Hi, this is Heather Fuller. I'm the director of the Sunflower Health Network in North Central Kansas. Just a couple of things to mention, mainly on vaccines, but first I will say that hospitals are starting to allow more visitors, both inpatient and emergency departments. Of course, it varies by each hospital, but the numbers are slowly climbing, as well as number of elective or, same-day surgeries, those types of procedures. They're allowing more of those. One of the big things that we're finding right now for issues is space for giving the vaccines, especially in smaller communities. They may not have large buildings or empty places that they can just convert for giving those out. So that's one of the big issues. Most hospitals have kind of made it through their vaccination efforts for staff. So for North Central Kansas, the average is 54% for hospital workers that have been vaccinated. So we're thankful we've gotten to over half there. Some hospitals are as high as 70%, so that's great. We'll keep working there and working into phase 2 as well. So that's all I have.
Thank you, Heather. I appreciate it. And we'll ask Dr. Watson from Cheyenne Mountain Software, who's developed the Mission Control app. He's been with us regularly to talk about the transfer situation in the state. Dr. Watson.
Yeah, great.
Let me make you the host. Yeah, sorry about that. There you go.
We're seeing real encouraging things across the state, and I think that's obviously reflective of what the rest of the state is experiencing. No, but certainly the times that it takes to move people, the percentage of those that are actually COVID positive, both down, as well as then the number of patients that need help finding beds. Certainly the capacity across the state is much better. We've got a majority of green, meaning normal capacity, and we're seeing that that these units, both normal COVID beds and ICU beds, are all opening up. So very encouraging again, and hopeful that everything that we're doing will blunt the spring spike as well, and that we'll be on our way to complete recovery and get past this for the summer for sure.
Thank you very much, Dr. Watson. Thank you for being here with us week in and week out. You too, Heather. So some updates for everybody. I just saw an article saying that, and I know that these regions are closely connected. South Central Kansas, for the first time in many weeks, is showing capacity in its ICU beds, which is great. We saw Wesley there in green, and Via Christi doing well also, or better. And so that's good. We also know the UK variant has been found to the west of this region and now to the south and in the Central County area. And that variant is expected to become the dominant variant by the end of March, and it is more contagious and a little more lethal. So the right time to continue to mask up and social distance and get out, to continue to be cautious as we roll out this vaccine as we can. Now on the vaccine, we had Dr. Marcy Nielsen, who's helping coordinate the state response around vaccine, with us on the first call today. Some of the data points that she shared with us. One that we'll just be hearing more from the governor tomorrow on the vaccine, so to be paying attention to that. They are continuing to have tech problems with data reporting, as I mentioned, which is creating a lag in the data and the actually number of vaccines that we've gotten out into arms. Their goal is to have vaccines in arms in 7 days from the time that they arrive. And so they are working on the balancing of urban and rural, and the Pfizer versus the Moderna, and how that all works. The retail pharmacy thing has been stood up, or program has been stood up over the last week. And so, be checking in your region too to see where that is happening. But those are more points of vaccination, and those are places that should see more vaccine arrive as they continue to just work out their own systems in place, as they have good systems as they do other vaccines as well. in what they work. As she was looking out in the 90 to 120 day window, she pointed out that we will continue to get more vaccine. The hope is Johnson & Johnson to be online by the end of February. Waiting for a federal government emergency authorization. Great thing about that shot is it's one shot, and 2 weeks later you're immunized. We're hoping just to see more vaccine coming in from the feds and into our state week over week with more points of opportunity, whether it's the retail pharmacy program and the great county and hospital and health network partnerships that we're seeing. And you'll see the conversation shift from an issue of where we have more people that want to get vaccinated than we have vaccine. Hopefully in the next 3 or 4 months, you'll see that flip where we'll have more vaccine or plenty of vaccine, and we'll need to be talking about vaccine hesitancy. And we'll be relying on physicians networks to help educate the public on the vaccine and why it's safe and how it works. So you'll be hearing more from the state on that as that conversation changes. Now we've had Carrie Ann be able to join us. She's been a regular for us. Carrie Ann, any update from what you're seeing in the public health front?
Oh, sorry, I'm late. I got caught on the phone working with the vaccine issue. No, nothing. I mean, our focus is still on the vaccines and getting people in our counties vaccinated. And I think I caught the end of what you were saying, but I mean, our struggle is still the amount of vaccine we're getting isn't anywhere near what we're needing for our community members and the number that we have on the list. So it's hard when it includes such a wide range of people. And I know I talked to somebody at the state yesterday and just told them our concern, was in the rural health area or in the rural areas. Most of our infrastructures are critical infrastructures, so they all want added on the list too in phase 2. So how do you prioritize 65 and older over the critical workers? So it's just a juggling, balancing act that we're trying to do here. So.
Nope. Nothing's been easy through this whole pandemic. Probably shouldn't start now, right? Well, thank you, and thank you for being here with us and getting on the call and providing your update. The other thing we've been hearing is to encourage people not to delay care. We were on the Kansas City call. They were saying they were seeing a significant drop in the number of cancer patients that they're seeing. And unfortunately, it's not a sign that cancer has gone away. It's just another sign that people aren't getting in for the preventative care, the regular checkups, and they're delaying care. So now with capacity, and I heard someone say on an earlier call, desperation beginning to leave some of the healthcare system, it's safe to go in to your physician, to the emergency department, at your local hospital to seek care if you think something's wrong. Don't delay and don't let this pandemic cause any more havoc than it already has. So just want to encourage people to do that. Has been an important message today. I'm going to kick over here to the bright spot. This comes out of Southwest Kansas. Just a great story that I saw picked up by a couple news sites. It's a YouTube channel called It's a Beautiful Day in Our Neighborhood. If you Google It's a Beautiful Day in Your Neighborhood, you'll get lots of Fred Rogers, who's a great guy. So that maybe you may like that too. But this is 2 physician assistants, Aaron Keeley and Rachel Svati, who were sitting at home one night thinking about their Somali neighbors and how to communicate with them in their language about the COVID vaccine, and had the idea to record video and realized that there's a lot of other people in need of this same service. And so 2 people thinking about how to love and care for their neighbor came up with this series of videos where they have a conversation about the COVID vaccine, and it's translated into all these different languages. What's great, Liberal, Garden City, Dodge City, over half the people, English is not their first language. And so you can see Somali and Spanish and Vietnamese and Karen and Arabic and so on, Burmese, just to use this. So I encourage everybody to use this as a tool. If you have friends or people that you serve in communities that don't have English as a first language, this is just a great way to help get information out. Information is really helpful, but also inspiring, as we've seen this so encompass what so many healthcare workers have done, which is just love their neighbor and care for them and think of ways to do that. And so I just love that story as a final bright spot for us. Before I wrap it up, does anybody have any closing thoughts or anything that they need to share? Dan, Heather, Dr. Watson? Okay, sounds like we covered it all maybe. Look, took a lot of people to make these happen, and just so grateful, Carrie Ann, for you being here week in, week out. Heather, Dr. Watson, Megan, and Ryan behind the scenes helping this go. Like I said, we're putting this program on hiatus with the numbers of healthcare system doing better. Should there be need to pick it back up, we will. Watch your email, and we'll let you know if we're going to pick this back up. But until then, it's the right time to finish strong with this disease as we roll out the vaccine, as more comes in, as our public health officials do their best to get it out as quickly as they can and into arms. It's a great time for Kansas to finish strong. So thank you everybody for what you're doing, and we wish you well until the next time